Welcome, ladies and gentlemen, to another exciting episode of the original Guru of Good Game with your host, the OG himself, Zero Game. Today on the OG of Good Game, mobile preventative healthcare satellite locations. Preventative healthcare for communities and rural areas that don't necessarily have a healthcare facility or a clinic that they can get quality preventative health care. We're going to get into that right now. Welcome back, ladies and gentlemen, to another exciting episode of the original Guru of Good Game with your host, the original Guru himself, Zero Game. Listen, I want to give everybody a shout out of love and thanks for listening to the show and for sticking with me as long as you did. I really appreciate it. Thank you so much. And I hope you keep on listening and rolling this journey with me. We'll see how far it goes. And for those that have listened and don't listen anymore, listen, I appreciate you listening for as long as you did. Thank you very much for listening. And if you don't find what you're listening for out there and you want to come back, love to have you listen again. So let's get in today's topic, and that is mobile preventive healthcare facilities. Now, we're going through a serious situation with this COVID virus. Before we get into this, I want to make sure that I let everybody know that we are now Wednesdays at noon is when the new episodes of the original Guru of Good Game will drop. Will be every Wednesday at 12 noon. This is now the permanent home of the OG of Good Game. Every Wednesday at noon. Just wanted to get that in there and let you know that we found our permanent home, and this is where we're going to be at from now on until the show ends. So I hope you stick with me, and I hope you enjoy the new time and date, and I hope it work out for you. That's only so you can listen more. Anyway, let's get into this topic today. We are talking about mobile preventive healthcare facilities. Now, we going through a serious little situation with the COVID pandemic. 28 million infected, over 500,000 dead and counting. And that's some serious shit. But we need to start working better at how we administer preventive healthcare and healthcare, period, to our citizens. And that's a real fundamental thing that we need to work together as a collective community instead of all this bipartisan bickering and back and forth and you said, he said, she said, you tweeted, she tweeted, he tweeted. Enough of this bullshit. Seriously. Enough. People are dying. And y'all sitting here playing this little back and forth grade school yard. I'm mad at you. You mad at me. We gonna go back and forth BS. Put it to the side for a minute and let's take care of our people. Now, one of the ways we need to start taking care of our people is preventative health care. We need to prevent a lot of these ailments and conditions that arise from long periods of time of not addressing certain health conditions that you need to, or just to know what's going on with you. If you're sick or if something's not working right or you feel in a certain way, it helps to be able to nip that shit in the bud before it becomes a problem. Now, the problem that we have in most working class communities is not enough available facilities that we can go to for preventive health care. See, back in the day, and I remember this too, doctors used to come to your house and check up on you and make sure you all right. Or if you get sick, they'll come through the crib, check you out, look you over, determine whether you need to go to the hospital or whether it's just something mild that you can eventually ride out. Now, see, that doesn't happen anymore. We got to blame money on that one because, you know, as more and more doctors were getting hit with lawsuits by the unscrupulous people, they decided, hey, I ain't doing house calls if I'm going to get sued for it. I came there to help you. Now, I'm not God. I cannot wave a magic stethoscope and everything is better. Certain things, there's just wasn't nothing I can do. The idea of preventative health care is to prevent health conditions before they get bad. Now, the problem is that we don't have these facilities in our communities. It costs a lot to build them. Or it costs even more to try to lease a facility. And you know how these commercial real estate guys is, they greedy as hell. And they going to charge you up the ass. So a solution, especially in rural neighborhoods and working neighborhoods or poor neighborhoods, let's just be straight up. In poor neighborhoods in the ghetto or the trailer park, whatever the fuck you want to call poor, the best way to do that is to turn shipping containers into mobile preventive healthcare facilities that can be run by registered nurses or head nurses, and they could do the things that mostly get done when you come in for a checkup. Take your blood pressure, take your heart rate, your temperature, check your breathing, and they can compile that and keep a record of, you know, how you doing. If your blood pressure was high this week, it was lower next week, you know, you can come back in daily for checkups and assistance. They can help with medication, helping you understand your prescription medication. And here's the main thing. They could administer vaccines. So we wouldn't have this confusion that we going on right now, basically left over from the previous shit show administration, because he just left everybody out to dry, said, fuck it, do it for yourselves. For those who like that shit show administration, how that small government worked out for you? Because he wasn't administering a damn thing as far as the vaccine or even protective equipment. So how that small government work out for you? Didn't do too well. Anyway, getting back on this subject. With these containers, we can design them so that they're off-grid containers or they can be on-grid. Solar panels, battery array, charge controller, set the whole damn thing up, drop it right in the neighborhood. Mobile preventative healthcare facility right there. You can connect to the satellite or whatever and transmit data and information. If need be, you can plug it directly into the grid system. But all in all, they can be lifted and moved where needed in whatever part of the community they're needed. And since we got so many of them damn things sitting in a junkyard, oh, we got plenty. And they can be left once they dropped as a permanent preventative healthcare facility. And people in the neighborhood can go there for, I'm not feeling okay. They can get a quick checkup. We can, since the Zoom thing is big time now, you can do live video calls with a doctor at a local hospital. And in that way, report directly live video to the doctor. You can even turn the camera on the patient, have the doctor take a quick look and say, you know what? Can't really tell from the camera, but I'm seeing some things that concern me. Schedule an appointment and have them come in. And then bam, appointment can be made. They can go and get checked up, and we can prevent a lot of the high costs that's associated with diseases and ailments that afflict us by preventing them from becoming a serious problem, by catching it before it does. And that's what these facilities would allow in the community and in the healthcare industry. We can catch a lot of this stuff before it get bad. Treat it to where we can get it under control, and in some cases actually reverse it and cure it. Simple solutions. You can retrofit these shipping containers to actually have the freezer on there that can hold the vaccine. And you can have mobile transportation from, say, a main hospital facility where they do have the ability to store the vaccines. And then just like Uber or DoorDash or Skip the Dishes, whatever them delivery services is, you can hire some hospital staff or people who want to make a few extra dollars doing vaccine deliveries. And they just hit up these locations as they report in needed. And you can have vaccines, boom, on the spot to these locations within 30 minutes. So even if you run out, you put in a quick online order or however you set up the system, and then they can be pulling them, stacking them, throwing them in the truck, Boom, driver there within 30 minutes. Because right now the logistics is what's causing the delay in vaccine getting to these pharmacies. And then the problem with the pharmacies is that there's only so many of them in so many areas. Because there's none in the poor and working poor communities. Ain't none of them in there. We got to go way the hell outside of our community to find a pharmacy that's going to do that. And transportation, time, sometimes it's just not convenient. And sometimes it's just not possible. But you can roll these shipping containers in, semi, drop them on a location, empty lot, parking lot, however you work it out as far as the community. Believe me, in the poor communities, you're going to find an empty lot to drop a couple of them suckers in. This is a way you can actually have home health aides, have a location that they can work out of in that community. So if they're doing home health aid and they feel like one of their clients is not looking too good, or maybe they came through and noticed that they was flushed or pale or looked like they was hot or sweating, got a fever or something, you might just, look like you're not feeling good. Well, you know what? Let's go on down here to this preventative healthcare facility. Nurse can check them out. They can live video conference with a doctor who can oversee the examination, and then have live streaming data coming right to his screen. And he can look at the blood pressure, the heart rate, the body temperature, whatever else that he might need to make it determine to say, you know what, have that person come in. And because you have these locations, which act as preventive healthcare maintenance, make it a lot easier for EMTs to know where they need to go to get to whoever they need to get to. That's just my thought on it. So, people, let me know what you think about this. Give me some feedback at www.oggoodgame.com, or you can email me with any of your comments, reviews, ideas to OGZeroGame@gmail.com. You can also leave a voicemail. You can call me at 716-562-6975. That's 716-562-6975. Give me a call. Leave a message. Let me know what you think. We'll take it from there and possibly put you on the next episode or follow up when we do follow up on this one, because we definitely going to do a follow up on this one. So keep listening. Keep coming back. If you go to the website, www.oggoodgame.com, you can subscribe right there on the site, and you can get info and updates, and we'll let you know on all the new exciting things we got coming. So sign up, and you can get all that info coming to you. And believe me, I'm not going to overload you with a whole bunch of damn emails. Only when new things is happening, or only when I'm giving you updates. That's it. We ain't going to go crazy on you. So I want to say to everybody, please be safe out here. Make sure, wear your mask, social distance, and wash your hands, so we can get this COVID thing out of our lives, or at least get it under control so we can get back to somewhat of a normal life. And more importantly, so we can stop having people die from it. And that should be the most important thing. We don't want nobody else to die from this virus. And we should all work to make sure that that don't happen. So I'm going to end this episode right now. I do appreciate y'all listening, and thank you for letting me throw this little idea out there to you. Hopefully y'all see some merit in it. And if you got any comments or any ideas or any way to make it better, or just to tell me I'm full of shit, hit me up. So that'll do it for me for this episode. And, time for me to end this the way I always end this, and y'all know I'm going to end this. Love, peace, and hair grease. And I'm out.